All right, today we're going to do something a little different. We're going to create a user's guide for a part of your body that sends some pretty important messages, your genitourinary system. We'll get into how your body tells you something's up and how doctors start to figure out what those signals actually mean. So, let's learn how to listen.
You know, your body is talking to you all the time. It sends these little signals through feelings, through changes, you name it. And the trick, really, is just learning to speak its language. A tiny shift in how often you have to go to the bathroom, or a new ache you've never felt before. These aren't just random things happening. They're data points.
And believe me, it's a language worth learning. Just to put it in perspective, about 15%, that's 1/5, of all first-time visits to a doctor are for a urologic issue. That's a huge number, and it just goes to show how incredibly common this stuff is.
So what exactly are we talking about when we say urology? Well, think of it as the specialty that covers the body's plumbing. For both men and women, that means your kidneys, your bladder, and all the tubes connecting them. And for men, it also includes the reproductive system. It's this really interesting field that's part medicine, part surgery.
Okay, so the very first step is learning how to listen properly. Your symptoms aren't just a random collection of annoyances. Nope, they actually fall into some pretty clear categories, and those categories are the very first clues a doctor uses. Let's break down how these signals get sorted out.
Generally, pretty much all urologic symptoms can be filed into one of 4 main buckets. You've got pain and discomfort, changes in how you urinate, changes in what your urine actually looks like, and then any issues with the external genitalia. Each of these points a doctor in a totally different direction.
Now here's where things get kind of weird and fascinating. It's a concept called referred pain. Pain can be a bit of a trickster. Because of the way our nerves are wired, a problem in one spot, say a kidney stone, can actually make you feel pain somewhere else entirely, like in the testicle. Your nervous system is basically getting its wires crossed. It's a classic case of mistaken identity.
Changes in urination are a huge clue, and they really get split into 2 main teams. On one side, you have irritative symptoms, things like urgency, frequency, that gotta go now feeling. That usually points to some kind of inflammation. On the other side, you've got obstructive symptoms, like a weak stream or having to wait for things to get started. That suggests a physical blockage, like something is literally in the way. Figuring out which team your symptoms are on is a really important first step.
And get this, your urine can be like a diagnostic rainbow. Seriously. Seeing red is obviously alarming. It could be blood, but it could also just be that you had a big beet salad for lunch. Some medicines can turn it orange, or even, and this is a real thing, green or blue. And if it's cloudy, might be nothing, just some harmless crystals, or it could be a sign of infection. It's all about the context.
Okay, this is really important. While lots of things can change your urine color, urologists have a golden rule they live by. If you see blood in your urine, what they call hematuria, and there is zero pain to go with it, that is a major red flag. It is always treated as a potential sign of a tumor until it is absolutely proven to be something else.
Right, so you've listened to your body, you know something is off, and you've made the appointment. Now what? Let's walk through the next phase, how your doctor starts playing detective and putting those first few clues together.
That first visit really isn't so mysterious. It's a pretty logical 3-part investigation. It all starts with just a conversation, you telling your story. Then it moves to a physical exam focused on specific areas. And it almost always wraps up with a simple but incredibly powerful urine test.
Now, to get a handle on your symptoms in a more objective way, doctors often use special questionnaires. The AUA symptom score is a classic example. It asks 7 specific questions about urination, and based on your answers, you get a score. This helps put your symptoms into a mild, moderate, or severe category, which is great for tracking if things are getting better or worse over time. The physical exam is all about a hands-on search for more clues. Your doctor might gently tap on your back over your kidneys to see if they're tender. They might press on your lower belly to check if your bladder is overly full. And yes, other specific exams like a digital rectal exam or DRE might be done to check the prostate size and texture. Every single step is just about gathering more data.
And then we have the urinalysis. This is one of the true cornerstones of a urologic checkup. It's so much more than just peeing in a cup. This one simple test is like opening a window and looking directly inside your urinary tract. It can spot signs of infection, bleeding, inflammation, even clues to bigger health issues like diabetes.
So a full urinalysis actually has 3 parts. First, there's just a visual check. What color is it?
Is it clear or cloudy? Then they use a chemical dipstick that can detect tiny amounts of things like blood, protein, or substances that suggest bacteria are present. And finally, a tiny drop is put under a microscope to literally count the cells and look for any bacteria or other funky stuff.
Okay, so at this point, the doctor has your story, the findings from the physical exam, and the results from the urinalysis. Now it's time to put all those puzzle pieces together. Let's use one of the most common blood tests in urology to see how this works.
Let's talk about PSA. It stands for prostate-specific antigen. It's just a protein that the prostate gland makes. Now, its main job is actually inside semen. It helps liquefy it. But tiny amounts of it naturally leak out into the bloodstream. By measuring that level, we can get a really good clue about what's going on with the prostate's health. Now this is probably the most important thing to get about PSA. It is prostate-specific, but it is not cancer-specific. Let me say that again. It is not cancer-specific. That means a whole bunch of other non-cancerous things can make the number go up. A simple enlarged prostate, an infection, even having a catheter recently, all of these can cause a high PSA reading. But with that said, the level of PSA definitely matters. As you can kind of see here, the chance of finding prostate cancer goes up as the PSA number goes up. The big jump happens once you get above a level of 10. At that point, the predictive risk climbs to over 60%.
And the impact of this one test has been absolutely massive. Today, a full 60%, more than half, of all prostate cancers are first suspected just because of a high PSA number. Often, this is way before any symptoms show up or anything could be felt on an exam. It has totally changed the game for early detection.
So after hearing all of this, what's your part in it? Let's wrap things up by talking about how you can use all this info to be a better, more proactive partner in your own healthcare.
Look, the whole point of knowing this stuff isn't so you can diagnose yourself on the internet. Please don't do that. The goal is to arm you with the right information so you can have a smarter, more productive conversation with your doctor. It helps turn your visit from you just listing symptoms into a real collaborative dialogue.
So what's the action plan? It's simple. First, listen to your body and don't just brush things off. Second, when you do go to the doctor, be ready to be specific. And third, just remember that the whole process is a logical investigation, and that every test result, whether it's a PSA or anything else, needs a professional to put it into the right context.
So, we've covered the signals, the clues, and the first steps a doctor takes. The information is all there, and it's coming directly from you. The only real question left is, what are you going to do about it? Thanks for listening.